I'm Dr. Ratna and I represent an organization called Indian Alliance of Patient Groups, and I'm based out of Delhi. The Indian patients are not at all empowered. They do not have a choice. They are harassed. They have absolutely no idea what they are getting themselves into once they are sick or enter into a healthcare facility. The healthcare system is not integrated. It's all fragmented. So once a patient enters the system, they are lost in it. They keep asking questions. They don't get all answers from one service provider, and there's a lot of variation between what happens in the diagnostic area, in the treatment area, and the post-treatment area. So there isn't information given to the patients, and that is why there is a lot of distrust, and people don't feel empowered at all. The Indian Alliance of Patient Groups is a cross-disease patient organization, and the idea generated about 4 years back when I attended a conference in London called IAPO, the International Alliance of Patient Organizations, where there are about 200 patient organizations from different parts of the world who came together to decide policies on various spaces in the healthcare arena. And when I searched around in India, I found there was no such umbrella. There were many vertical organizations that were working on one disease specific area, but nothing that integrated all of those diseases together under one umbrella organization to work on cross-cutting areas like, say, quality or access to healthcare or financing the healthcare system, or even empowering the patients to manage their diseases once they are out of the healthcare system and in their home spaces by building their capacities, especially in the area of non-communicable diseases, because most of these non-communicable diseases are lifelong, especially things like cancer or heart attack or diabetes or hypertension, some things like mental illnesses, post-stroke management. Everything needs home management, and most of these hospitals just manage the disease as long as the patient is there in the hospital. Once the person is discharged from the hospital, there is no counseling or follow-up to that care until the next crisis happens, and the person then lands back into the hospital, back into a crisis, back into managing finances, and the cycle goes on till the finance is over or the patient dies. Between the two, one happens. So we needed something that would empower these patients to collect together as one voice and represent to various stakeholders, whether it was the government that was making the policy, whether it was manufacturers who had to invest in new treatments, in new diagnostics, in new protocols, whether it was other areas that impact healthcare, environmental organizations, sports facilities, many such other cross-cutting areas where normally people do not think of it as a healthcare domain, and the institution or the body that spoke about it had to be neutral, had to be seen without having any financial or commercial interests. And the best way to do that was to get all these active groups together under one umbrella. So we started off in December 2012 by calling for a consultation in Delhi, where about 16 organizations came together and discussed this, and we felt that we should come together formally. So we launched the organization on October 8, 2015, and since then we have grown from a 12-member body to about 30 members now that represent a spectrum of diseases, from non-communicable to rare diseases to mental health organizations to genetic disorders. And all of us now are working independently, individually in our own specific areas to represent our own disease areas and bring them to the forefront of policy, as well as jointly working together to represent to various stakeholders cross-cutting areas like quality of healthcare, which currently is not measured anywhere or is not published, even if it is measured. Some kind of transparency in the healthcare, the environment and the portfolio that is being managed. Bringing the patient to the forefront in terms of managing their own disease and taking their own decisions, so increasing and improving the communication between the service providers as well as the patients, and most importantly building capacities of these patients to manage their condition in the environments of their home so that the trips to the hospitals or healthcare facilities is reduced greatly. So that's some of the major work that we are doing. As I mentioned earlier, we are working with various stakeholders, and while we have had a lot of success on policy with the government, the sustainability of the organization and the vision and the support has actually come from industry associations like OPPI. They have been extremely helpful in building resource materials that help build capacities of patients to understand disease progressions, to understand what are the newest therapeutics and diagnostics available in the country as well as abroad, to be able to manage advocacy campaigns that help various patient groups to come together and discuss areas of common interest. They have been our sustainability mechanism, helping us physically, mentally, spiritually to stand together in face of several challenges. And we are really grateful and deeply indebted to them, because although they have supported us right from the beginning, they have never interfered in the way we work together. They have always been supportive from the outside, guiding us gently, giving us the information that we need, and sometimes connecting us to the right people so that we are able to place our voice in the right forums. And OPPI has been a great supporter in this whole cause. They are the ones who've been supporting us to a large extent.